So you're having stomach troubles, headaches. Is there any other physical symptoms that you're experiencing?
Possibly not actually a panic attack, but like I'm on the verge of one.
Okay.
And it specifically happens, well, majority of the time it happens right when we get a call for help regarding a situation that's going on. The trembling and my heart is beating out of my chest. But then there are some times when I'm at home and I get a phone call from an unknown number, like it'll happen.
Right.
Because I think it's my job calling.
Right. So it seems that your symptoms are job related more than anything. Would you say that? That it kind of revolves around your work?
Mm-hmm.
Are you experiencing any sleep difficulties with this, or yeah, like you sleeping too little, too much, poor sleep quality?
Sometimes I have a
dreams?
hard time falling asleep because I feel especially depending on how the day went, I'm so amped.
Right.
I can't calm down, and sometimes I'll call my mom and I'll make her stay on the phone with me until I can actually fall asleep.
Right. So do you exercise?
No.
No.
No, I don't. I'm too tired, or just
I understand.
in theory. Good idea.
What about your appetite, your eating habits? Is there been a change in those?
Yes. Well, actually, I went through a phase where, in the beginning, where I was just eating my emotions, but
Okay.
like that didn't last long, and it got to the point where I didn't have an appetite anymore. Like I may nibble on
But
things.
is that how you're at now? You're just
Yes.
kind of like,
Mm-hmm.
is that only while you're at work? Is that at home or?
Oh, I definitely don't eat anything at work.
Okay.
And when I'm at home, I may nibble on something.
Okay. So have you experienced any significant weight changes because of this?
No.
No. Do you regularly consume alcohol?
Maybe. Yes. Yes.
Yeah. So in a month's time, how often do you think you consume 4 or more drinks in a 24-hour period?
Not for more than a 24-hour period.
No.
I couldn't tolerate that.
Right.
And that would just make things worse.
Make things worse.
So, like, it's typically 2
2.
tops.
Okay.
2 tops, but majority of the time it's 1.
Mm-hmm. And that kind of helps. You feel like that kind of helps you take the edge off a little?
Yes.
How often do you engage in recreational drug use? Never. Do you smoke cigarettes or use other tobacco products?
No.
Have you ever had suicidal thoughts?
No.
Okay. Are you married, dating, divorced, single?
I'm single.
Single. Okay. In the last year, have you experienced any significant life changes or stressors? I know you said you moved and you got this new job, and other than those things, has there been anything else? It's just the move and job.
Yes.
Okay. All right. Have you ever experienced any of the following? Extreme depressed mood?
Yes.
Okay. Dramatic mood swings?
No.
Rapid speech?
No.
Extreme anxiety?
Yes.
Panic attacks? You said you thought you might be experiencing those.
Possibly.
Possible. What about a phobia? Do you have any phobias? Like extreme fear of something?
Roaches.
Does this seem to interfere with your life, or?
I think so, but
Okay. You said you did have sleep disturbances. What about hallucinations? Are you
No.
seeing things or anything that's not there? Unexplained losses of time, like when you were there and then you don't remember what happened the past hour.
unfortunately, no.
You want to experience that at work?
Yeah.
collapses. Frequent body complaints. I mean, your stomachs and stuff pretty frequent. What about repetitive thoughts, like obsessing over things? Like, do you constantly think of things?
There are times where, when I'm really stressed out or anxious about my job, where it's like I have this dialogue in my head about, like, how everything's about to spiral downward in regards to just me not being able to perform, or just things happening at my job that cause me to fail.
So do you have a fear of failure at work? Like, you feel that if you don't do right, something bad will happen?
Exactly. You know, the thought of, okay, I'm stressed, I'm not comfortable, I'm still adjusting.
Okay.
And I make this big move, but what if I have to move back?
Okay, so what you're saying is that you made a move from, you said Jackson to Oxford, and that's a pretty good distance, so you're afraid that if this doesn't work out, you don't know if you'll have to go back or what's going to happen. So it's kind of the fear of the unknown.
Exactly.
Okay. Have you had any homicidal thoughts? No suicidal thoughts? Okay, now we're gonna get to a little bit of a more difficult part for you. We're gonna talk about your work a little bit. So you are employed. Where do you currently work?
North Mississippi Regional Center.
And how are you feeling in this job? I know you said you felt anxious, and is there anything else about it that, like, stressors or anything else that you would to share?
Well, I mean, it's kind of weird just working in an environment where not everyone gets along.
Okay, so would you say that your coworkers, you're unhappy with your coworkers?
Yeah. Disappointed. Disappointed.
Okay. I know you said you had kind of a fear of failing. So is the work itself stressful, or is it just the coworkers?
It's both. It's a combination of that.
So what do you do? Like what's stressing you out? Like, what are you doing during the day? Like, what job requirements do you have?
Paperwork. Implementing or training staff how to perform behavior program techniques.
Just I'll keep those. Y'all talking about some stuff? What?
Addressing client behaviors, and a lot of the time I spend responding to tedious phone calls or emails or attending meetings.
Right. So there's a lot of responsibilities.
Yeah.
Does your work require you to be on call or anything like that? Oh, so it's like it doesn't end when your shift ends.
No.
Okay. And are you on call? How often are you on call?
Well, technically it's 24/7
Okay.
because they're supposed to be able to contact me to notify me if behavior got really bad.
Okay.
And basically, I guess that's how I'm on call. I could
Okay.
be wrong because I'm still learning.
Right.
I'm still learning how it all works.
I understand. So you have a lot of responsibilities. You're on call, and just seems like your work takes up a good chunk of your life.
Yes, it
Yeah.
does. It does.
Okay. Would you be comfortable sharing any of your religious, spiritual information? Like, would you consider yourself a religious person?
I identify as a Christian.
Okay. Okay. All right. And what about your family mental health history? Is anybody, like your immediate family, like your father, mother, grandfather, grandmothers, things like that, experience depression,
Not to my knowledge, no.
bipolar disorder,
No.
anxiety disorder,
No.
no, panic attacks,
No.
schizophrenia,
Mm-mm.
alcohol or substance abuse, eating disorders,
No.
learning disabilities,
No.
trauma history,
Possibly.
possibly. And who would?
My mom.
Okay. Suicide attempts
No.
or chronic illnesses.
Mm-mm.
Okay. So I just have a few more questions left. Do you have any strengths, things that you would consider yourself to be strong in?
Well, I want to say my faith, but it's been very challenging to
Mm-hmm.
keep up the same habits I had as far as going to church,
Right.
staying the word on a regular basis, and especially waking up in the morning to do it. But my family would definitely be a strength.
Okay. So you have good family support.
Yes.
What do you think is your best attribute or the thing you like best about you?
I think that despite everything that's going on, I've been good about not showing how just stressed out I've been.
So you would
I've
say,
been able to remain positive.
right, you put on a good face and can get through the day, remains positive.
Positive towards others.
Okay.
Like,
But you don't feel that
No,
on the
not at
inside. It's just
definitely not.
kind of like an inward battle, but on the
Mhm.
outside, everything's fine.
Yes.
Yeah. Do you have any effective coping strategies that you've learned? I know you mentioned calling your mom, and does that help?
Yes, it does. It does. When I can get to it. Yes.
Anything else?
Coping. Well, it used to be eating, but I don't do that anymore.
Right.
Well, when I do make time for it, the actual prayer and worship.
Okay. What goals would you have entering therapy?
Well, to be able to, one, learn how to maybe, I don't want to say compartmentalize, but maybe that's what I need to do in terms of work.
Okay. So, in other words, leaving work at work.
Exactly.
Leaving work
Yes.
at work and being, not taking that home.
Mm-hmm.
Okay. And maybe maybe we could work on finding good coping strategies from when you are at work, things that might help you relax a little bit, things like that.
Mm-hmm.
Would that be something you're interested in if we were to do therapy? Okay, well that is something we can definitely work on. I definitely see that you do have more anxiety when it comes to work, and maybe we can look at things about that. You interested in continuing therapy?
Yes, of course.
Okay, well, we will be in touch on when we can meet again, and it was nice to meet you.
All right, thank
Thank
you. Nice
you.
to meet you too.